I am Michelle Benoit Wilson, a PLME alumna who graduated from Brown undergrad in 1995 and medical school in 1999. I am delighted to welcome you to the Charles O. Cooke, MD, Distinguished Visiting Lectureship. This lecture was established in 1994 through a bequest by Mrs. Ruth Cooke Peterson. Her hope was for Brown to host a conversation in any branch of medicine that can hold the promise of significant and lasting benefit to medical education at Brown, to the community, or to the delivery of healthcare service. That is certainly the case for my fellow Brown alumnus and my classmate and former housemate, Dr. Pooja Tandon. Pooja is a pediatrician and child health researcher at the University of Washington and the health director at the Trust for Public Land. After she completed residency training at the Boston Combined Program in Pediatrics, Pooja worked as a general pediatrician and then went on to complete a general pediatrics research fellowship and a Master of Public Health degree at the University of Washington. While she continues clinical practice, her research interests include studying and intervening on social and environmental determinants of children's health, in particular, child obesity. Her research has been funded by the American Heart Association, the Safeway Foundation, and the National Institutes of Health. Her current projects focus on studying the connection between outdoor play, physical activity, and various health and developmental outcomes in preschool-age children. Please join me in warmly welcoming my housemate and my friend, Dr. Pooja Tandon.
Oh my goodness, that was too much of an introduction. Thank you. This is such an honor and a privilege to be here, and I didn't exactly know where this building was, and then when the Uber pulled up, it was where by Andrews, where I started over 30 years ago. I came here literally as a teenager, and as a pediatrician, and I see many pediatricians in the room, I think of this like I grew up at Brown, and those early, the early relationships, the foundation that I have here have really been inspirational and significant in my life. So this is an honor to be here and to be with so many of our classmates. I just wish the chairs were purple, and then it would really bring back the Purple Palace feeling. So thank you for being here. I am talking about play equity and how that promotes health equity. Let me just move on to the next slide here. I'm sure all of you in this room are familiar with the concept of health equity, that idea, the state that each of us deserves the opportunity to achieve our full health potential. But maybe the concept of play equity is a bit newer, so I'll be speaking about that. And then I'll talk a little bit more along the way about some of my work and how it's connected to my role at Trust for Public Land, along with being at the University of Washington, and you'll see how it all comes together. But let me define play equity first. This is the idea that all children, and arguably all people of all ages, need opportunities and resources to participate in physical activity, sports, outdoor recreation, ideally in nature-rich environments. This has implications for social justice, for environmental justice, and central to what I do. But first, we're gonna bring you back to med school and with a quiz. So, I'll have you raise your hand so you commit to something here. What percentage of children in our country, so school-age children, 6 to 17, do you think meet the recommendation, which is 60 minutes of physical activity movement every single day? So A, 15%. Oh, a lot of doubters in the room. B, 21%. C, 33%, and D, 42%. Okay, so the overall answer is B, but actually younger children, a larger percentage. This data is from 2019 to 2020. There is research to suggest that during the pandemic and post-pandemic, the rates have gone down. But in general, if you think about overall trends, younger children do better than older children. Girls, the decline in meeting physical activity recommendations is more significant, more precipitous, especially in the middle school years. So it's a significant concern. And then just to kind of review what the physical activity recommendations for the different ages are, I'll pop all the kids on here at once. So the littlest ones, we want them moving, we want them on their tummies, we don't want them restrained in car seats or other apparatus for long periods of time. For preschool age children, in general, the thought is about 15 minutes of every hour as like a benchmark of trying to get them to move. Often when we work with early childhood educators, that's a good way to think about it. The most concrete recommendations that have been linked to health outcomes are the kids over 5, the K through through 12. Really at least 60 minutes a day of moderate to vigorous intensity activity. And the sort of qualitative piece of this, we don't love when they're only doing one sport all the time. We like them to enjoy a variety and engage in muscle strengthening and aerobic activity. And then for everyone in this room, at least 150 minutes a week. And that actually it can be broken up in any different way. So if you're a weekend warrior and need to get it all done Saturday, Sunday, if you're 22 minutes a day, that's if you divide it out, that's how I sometimes think about it for myself. I'm just gonna go walk for 22 minutes, and I've done extra minutes up and down my street to get to 22. But there's not, you can accumulate it in any of those ways. And for people of any ability, almost any chronic illness, and except for maybe temporary or the rare conditions where physical activity may be restricted, almost everybody can benefit from doing more than what you're doing now. And so even long before the word pandemic, reached our daily conversation, we have been experiencing a worldwide pandemic of physical inactivity with the minority of children really meeting the physical activity recommendations, less than 5% of adults participating in 30 minutes of physical activity a day, and as I mentioned, from very young ages, girls becoming less active than boys. And there are many reasons why children need to be active, and what motivates sort of my work is when children are active, when they play, when they move their body, it's important for their health, their wellness, their social development, their physical development in childhood, but also puts them on a trajectory of living, having active lifestyles, having the confidence, the joy to participate in movement throughout their lives, with implications for adult health as well. This is, like a classic med school slide, but I just wanted to throw the list of benefits for evidence-based benefits for physical activity, and it's not limited to healthy weight status and heart disease and the kinds of things that we might think of automatically, but is related to lower incidence of certain kinds of cancer and mental health and cognitive performance into our older years. So, many of these independent of weight status. So regardless of whether or not your weight changes or you lose weight or at any, really health at any weight, having more movement of any intensity can be beneficial. And the list looks very similar for children as well, many of the same health benefits, but a few more that the pediatricians and those working with children's health can appreciate in terms of improvement in symptoms of ADHD, cognitive performance, and even data for grades and standardized test scores, also independent of weight status. So lots of reasons to be physically active. So as I was working in this space and as a researcher about 15 years ago, one of the most consistent correlates, one of the most common predictors of physical activity was outdoor time. And that was like, well, yeah, if you let children spend more time outdoors, they are going to be more active. But not all outdoor spaces are created equal. And so I started thinking more about, when children are outdoors in a concrete, cement, plastic structure kind of space versus when they're in a nature-rich environment, how is that different? And what other benefits are they getting, what other experiences are they having that are going to serve them well. So just right before the pandemic, a group of us came together and focused on a literature review. So we wanted to sort of scour the literature on nature, what's been written about nature contact and children's health. And we looked at all different types of exposures, from kind of gardening interventions in preschools to wilderness excursions for youth. And but the most common ones are actually related to nature and green space around homes, like in neighborhoods and in schools. And that was actually kind of some of the most compelling literature, is that when children grow up in neighborhoods where, but through satellite images, within these buffer zones, there is more green space, more tree canopy. It's beneficial for their health for so many reasons. Or when their schools have trees and green space. So even the sort of, the gardening in the wilderness and the national parks and the faraway nature has some benefits, but there's a lot of benefit to nearby nature and having those nature experiences in their daily lives. And then the health outcomes, the strongest evidence was for physical activity and mental health. And so again, more support for the things that are public health priorities, that there is a connection between having access to parks, green space, and nearby nature, and some of our pressing health conditions of our time. Just in this way, kind of summarizing some of what we found in that paper and other literature out there in terms of the potential benefits, or what the evidence has found in terms of health benefits of nature. Everything from reduced stress, or studies that have looked at cortisol levels, to improved sleep outcomes, improved birth outcomes. So I know there are some OBs in the room as well, or those taking care of pregnant people. There was a large study in Europe across, I think, 7 or 9 countries, 70,000 pregnant people, and found that those that lived in closer proximity to nature or more natural green space in their environments, there was lower incidence of low birth weight babies and premature babies. So a lot of these studies are cross-sectional, but consistent and significant in terms of large sample sizes. The better eyesight one is also some really large and interesting studies, a lot of them done in China, where they've done interventions of increasing like recess and outdoor time for children, even 40 to 60 minutes a day, and that's associated with like slowing the rate of progression of myopia, or even the development of myopia. So the ophthalmologists are like all over this idea that outdoor time and encouraging children, and you could think of the possible theories. It's not consistently clear, but children, when they're outdoors, they're less focused on the close range activities of our phones and our screens. And so that allows for probably the healthier development of their vision. So faster post-op recovery. There were some of the early studies, these were in adults, where they, post MI after a heart attack recovery in the hospital, and it was one of those scenarios where, one side of the hospital room like had beautiful window views of nature and trees, and the others looked at a brick wall, and there were some significant findings in terms of hospitalization days and discharge that were better when the patients had views of nature. And then for children, I mentioned the academic benefits, but also the pro-environmental attitudes. Maybe not something that as healthcare providers we think about a lot, but I think significant as we think about the health impacts of things like climate change and connection to the earth and to the planet, and thinking about the reciprocal relationship of human health with planetary health. So lots of reasons for children to and all of us to spend time in nature. But as a scientist, you're like, well, what's the mechanism of action? How does this nature help us? And it really depends on which outcome we're thinking about. There's not one clear outcome. There's when you're outdoors, when you're in nature, usually people are moving, or moving more than they might be indoors. You don't have to move to get those benefits, but some of those benefits are from physical activity itself, or this idea of green exercise, like if you're running on a treadmill, facing this versus, facing a natural view, there may be other benefits that are above and beyond the cardiovascular and musculoskeletal things that are happening at the time. There are theories around attention restoration and stress reduction. Immune function, so studies, many of these in Japan around forest bathing. I don't know, has anyone heard of forest bathing? But this idea that you go into a forest and there are actual chemicals that trees produce, phytonicides that are meant to protect them from bugs and insect, but have been associated with like improved natural killer cell activity. So there's potential benefits to immune system, certainly microbiome when children spend time in dirt or in dirtier environments than our hygienic spaces, that there may be benefits to their immune system. Biophilia is this idea that as humans, we have a genetic connection to nature, and there may be something restorative and beneficial about being in those spaces. Certainly clean air, noise pollution, those types of things. And many of us, and especially children, are not spending time in nature alone. So there's this idea of like, who are we with? Whether our family members, intergenerational, or peer kind of social capital. So many reasons that being in nature could be beneficial for all the various health outcomes that I mentioned. And all of these, became particularly compelling during the pandemic when all of our sort of, this sort of collective trauma that Deb talked about earlier, and our usual places to spend time and be with others were cut off. And so one of the things that during this time that I'm a physical activity researcher and had been, thinking about these things as a researcher for over a decade before a pandemic hit. So one of the things that we pivoted to was trying to understand the role of park access as people were kind of going through the pandemic, to see that if people have access to parks, how does this improve their how does this relate to their physical activity and mental health, and what they're spending time on together. And so we did a national survey. This was kind of early pandemic, October, November, pre-vaccine, when we were still all walking around with masks, and a lot of hybrid education at the time. And with 1,000 parents of children, younger children, older children. For the teenagers, we also asked the young people, we had them fill out some standardized measures of their mental health, the Strengths and Difficulties questionnaire for those that are familiar with that. But I'm just gonna kind of summarize, but the question was, do you live within a 10-minute walk of a park that you feel safe going to, as the kind of predictor here. And this 10-minute metric is becoming more widely used, as often thought of as about half a mile to a park, but as a metric of like park access. I'm not saying that having a park within a 10-minute walk means that you'll go there or want to go there or feel safe there or feel like you belong there, but that is something that, like on GIS and mapping systems, people can map out and look for. So having that self-reported access to a park was associated with more time together. So parents and children reported going to those parks and participating in physical activity more often. And the parents reported on a PHQ-4 their own symptoms of depression and anxiety. So having park access was associated with better mental health for the parents, and better mental health for the children of both ages, the younger and the older. So, an important consideration as we think about the resources that our children, our families, our communities need to be able to overcome the kind of a stressor that a pandemic brings, but also acknowledging that there are a lot of stressors in our lives even without a pandemic. So this is, being recognized more. Deb talked about ACEs this morning. This wheel, Stress Busters, actually came out of the California Surgeon General's report from 2020 as a strategies to build resilience to ACEs, to those adverse childhood experiences. And they have a nice website that sort of talks about all of these different potential stress busters that, again, a lot of times you look at this, you're like, wow, my grandmother could have told us this. But, there is like increasing evidence now, which is sometimes what it needs to get policymakers and funders behind. But yeah, thinking about, how do we address these ACEs and the stressors, and how do we build resilience, again, in individuals and in communities? So along with healthcare and relationships and sleep and nutrition and physical activity, access to nature is one of those. And then it also made it onto another wheel, which is from the Federal Plan for Equitable Long-Term Recovery and Resilience. So this is a vital conditions framework, which again thinks about not just what we need for our basic health and to survive, but what do we need to thrive, and thinking about in addition to housing and basic needs, we need lifelong learning, and we need a thriving natural world and access to it, and at the core of it, the belonging and civic muscle. So this idea is becoming more recognized. I think it did take kind of this idea of bringing evidence to the forefront to convince the people that wouldn't just want to listen to our grandmothers about this. And now there is actually underway a national nature assessment that several of us have been asked to participate in, with the idea to assess what is the status of our natural world, and thinking about access from that's sort of what my piece in this is not just like what is the environment, but do people have access to it? Do people have equitable access, and the impact on our economy and public health as well. So there's I think a lot of attention to the role of nature and nature contact for health. And finally, as we think about climate action, and as a planet, as we think about how do we slow down the impact of climate change, and how do we adapt to it, nature-based solutions are at the core of that. Like when we think about parks and protecting green space and land, and that's where I want to mention my recent role at the Trust for Public Land. So I've been at University of Washington for 18 years or so as a pediatrician, academic pediatrician, but had been doing some work evaluating the impact of parks and green schoolyards, and through that was able to join the Trust for Public Land as health director. So they're a national nonprofit committed to protecting lands and creating parks, particularly in communities and places that don't have easy access. And so, when I talk to like trainees or medical students or residents, I mention that to say that you never know where your career is going to take you, but there are so many options out there in making a difference in the health and well-being of people. So I've been lucky to kind of merge those interests, and as we think about the planting trees and parks and the role that they play in managing extreme weather events and stormwater, I've been learning a lot about that, and in particular that parks are really cool. This is a map of New York City, and looking at kind of the heat index, and the orange and redder areas are hotter. They're above kind of the temperature deviation from the mean. The green ones are green and blue are cooler. And if you look at some of the nice green areas there, those are some of the well-known and popular parks of New York City. So a nice rectangle of Central Park, and this is borne out other, LA, for example, or Arizona. There's a big movement to study heat in schoolyards, and sometimes those schoolyards are 10 to 15 degrees hotter than the surrounding neighborhood. I mean, there are no trees, there's nothing there, and if you think about children who need to play and learn and do all the things, that is not a great environment for any of that. And so as we think about park inequities and environmental injustices, want to just point out that 1 in 3 people in this country do not have easy access to a park within a 10-minute walk, and that's again from kind of mapping data. 28 million of those are children. And Of course, as expected, that access is marked by disparities, many of them systemic and structural or historical redlining, determining where parks were placed and who lives in what communities, so that parks that serve majority non-white and families with lower income households tend to be smaller, more crowded, of lower quality, feel safe and have fewer amenities. And my colleagues at Trust for Public Land and others really talk a lot about this idea. Like, you can't just, even if you build a park, doesn't mean people are going to come. So how do you make a park where people, with community input, with that participation, to make it a place that feels safe and feels welcoming and has programming? So this idea of park activation is really important, and community input to make sure that people feel safe and welcome in those spaces. So in the next kind of piece of my talk, I'm going to just highlight a few examples of approaches to increase play equity that I've been involved with. These are just a few, and there's certainly many, many others. And this socio-ecological model, I'm sure many of you are familiar with, but this idea of, like, there's so many levels to make a difference, and where do you fit in? Where do you kind of place yourself or a program or an intervention in this? As someone, trained as a doctor, as a pediatrician, like, the most natural place that I initially thought about this was, how do we change behavior? Like, how do we use those four walls of the exam room, or how do we use our clinical interactions to, improve play equity or get children outdoors and moving? And, unfortunately, there's no app for that. And this is my colleague from Boston Medical Center, BU, Jack Maple, who is a cartooning pediatrician, so I want to just shout out to him. But there's this idea of a parks prescription or nature prescription that's been around for a while, and it's taken different forms. Nobody handwrites prescriptions anymore, but going back to that day, this idea that, like, if we as doctors can just, like, prescribe going to the park, like, maybe that'll work. And people are trying different versions of it. I would say, like, the 2.0 versions, what I think about, are more likely to have success. So not just like, here, go to a park, but really thinking about, what are the barriers and challenges and assets that a person brings, a family brings, that's going to actually get them to outdoor spaces. And there's some cool models. There's Dr. Nusheen Razani is a pediatrician in the Bay Area, and she started a program where her clinic, like, she herself or somebody from the clinic, a physician or a staff member, would meet their patients in a community park one weekend a month, and they would do a potluck, and then they would walk through the park together. And she had great success in a program like that. And there are a lot of other kind of walk with a doc type programs in other parts of the country. So I think that, like, moving beyond that, here's a prescription, but how do we really think about the reasons people are not going into parks? This is a project that I've been involved with in the Seattle area, and now broader in Washington State. Maybe it'll scale further, but this is based on an idea of some of you, maybe from, if you were working in a clinical space or in a pediatric clinic, know about Reach Out and Read, which is an idea that clinicians are giving a book in the early childhood years. And so loosely based on that idea, where there's a nature toy, age-appropriate nature toy, like a magnifying glass or sidewalk chalk, or Frisbee for older children, and some resources, and really a conversation about how do we get this child, this family, to spend more time outdoors. So we have a current project going in 6 clinics in Washington to see what this shows. Something based on what Deb said earlier. I think the cool thing about this is a lot of the providers really enjoy it. They love having that opportunity in this very small, short visit where you have a lot to cover, but an opportunity to talk about something that's health promoting and helps them connect to kind of their own well-being for just that minute. So more to come on that, hopefully, in the coming years as we try this model out more. Right now we have it in 4 different languages, and as I mentioned, trying it in 6 clinics in Washington State. But then, very quickly it became apparent that this is not going to change park equity. I mean, this is one level of intervention, but we need to think broader. We need to think about how do we make nature contact easier and the default in a lot of settings. So I want to mention this green schoolyards or community schoolyards type of intervention or program that I learned a lot about through Trust for Public Land, but is actually a national movement that several organizations are part of to transform. This was a real schoolyard, something like that into something like this. I'll just go back and forth, but schoolyards can serve as, a very important place where children are engaging in health-promoting behaviors or connecting with each other. And a lot of the ones in like New York City, for example, are built in ways that can be important for stormwater reduction, for heat reduction, and I'm really into wheels today, like these circular. I realize this is like my 4th one. But yeah, I didn't make any of them. But this is, the benefits of green schoolyards are many and span the sort of health and wellness and but community environment and learning. And the best way to do it, and the way that I think many of them are being done around the country, is with that community participation. And so TPL has this like great curriculum. They'll do, often these are elementary schools with 3rd through 5th graders, and they get them to like draw what they would love to see in their schoolyard. And there's, like roller coasters and hot tubs and like all kinds of requests that come in. But eventually through a designing process, they come up with a plan that's then carried out. And the key part of this is not just that it's a schoolyard for the school, but through a shared use agreement with the Parks Department, you can do something that becomes a community park. So if it's open to the public after hours and on weekends. So it's complicated, it's not straightforward, but there are models of it around the country where it's happened. And one thing I learned is that schoolyards are among the largest landowners in the country. So those of you that live in urban areas where you're like, yeah, this is nice, Pooja, but like, where are we going to actually build a park? But schoolyards are, they're one of the largest public landowners in the country. Elementary schools often are walking distance, or at least placed in ways that some proportion can get there easily. And so, like for example, in the city of Tacoma, which is about an hour south of Seattle and has one of the largest park access gaps in the country. So in this case, 69% of Tacoma residents could walk to a park. And if every elementary schoolyard was converted to a park and open to the public after hours, for example, in this case, 88% of the residents would be able to walk to a park. So I think it's a strategy that has a lot of promise. And especially when you think about the schoolyards that are in some of the communities that, I don't have pre-photos, but just last week I went to an opening of a community schoolyard in Tacoma. So they're over 2 years converting 5. And my favorite is the sign here that talks about we invite and welcome our community to enjoy this space during non-school hours. So that's the hope, and the other picture on top is the opening, and they had like a lovely, the student ASB, the 4th graders led the opening ceremonies, and then I have heard in the couple weeks that it has been open that there's been a lot of response and people there on the weekends and after hours using this space. So again, really thinking of it as a community schoolyard as a way to increase that park access. And then I'm going to just give an example of the policy, that outer realm, which ideally would impact the highest number of children, but depends on the level of policy. So this example is for equitable recess in Washington State, led by a community coalition called the King County Play Equity Coalition. And I was honored to be part of that group of youth-serving organizations, schools, pediatricians and youth who helped advocate for equitable recess, which, again, seems obvious that it's a equitable way of providing children with opportunities for outdoor time. But in 2022, only 10 states had laws requiring recess, and Washington was not one of them. Like, there was no law that said children must have recess every day. I didn't realize that. Children in high school by then, who were luckily in schools where they got recess most of the time. But we did a survey of parents right as we were starting this work about, how much recess does your child get? And some parents don't know, but often for elementary students, parents have an idea. And some were as few as 10 minutes a day. Some parents talked about, their recess being withheld to finish academic work, for punishment, all kinds of reasons. And then if you're curious about your state, I did put that table in there. So this is updated as 2023. Rhode Island does have a law, maybe one of the earlier ones, requiring 20 minutes a day. Not great, but at least there was a regulation on there, and discourages withholding recess. But there's kind of a range of what recess laws are out there. And there is research to suggest that, I'll move back here, that state recess laws do increase the odds of kids being physically active. And so when you leave it up to individual schools or districts, sometimes it just doesn't happen, even with the best intentions. So just to summarize kind of what we did, we worked as a coalition, and it was a big learning experience for me in terms of how legislation goes down and all the players and factors at play. But we eventually this bill did pass, and starting this next school year, K through 5 will be guaranteed 30 minutes of daily recess, to be held outside whenever possible, discourages withholding recess for academic or disciplinary reasons, and encourages outdoor breaks for older children. So as of right now, one of the strongest recess laws. But yeah, still most states still don't have recess laws, which is shocking to me. This is just we like to celebrate when we can about. So this was the signing, and it was an exciting moment for those of us involved to actually see a conversation or an idea go to actual signing of a legislation. There's so people with so many roles in this room. This was just like a graphic I got from Google. So, but we have many different roles, and I think about, in all of those roles as a clinician, researcher, private citizen, which also, as a parent, as a sister, as a caring adult in the lives of whoever that you have in your sphere, what I invite you to think about, what is the role that you can play in terms of play equity, or where you fit in that model of individual behaviors and to changing things that are happening at your community or at your school or in the people that you work with, and how do we get more of us moving and into spaces that are filled with nature. So I will stop there, but in each of our roles, I think just thinking that we have the opportunity to act, and thinking about where we can go with that, and how do we continue to promote play equity. Okay, and then I'm going to end with a self-promotion, but I do have a book coming out on this, which has been like a new frontier for me, but digging into nature for happy and healthier kids, and last year got to do a TEDx talk on it. So it's been a fun journey to think about an area of passion and scholarship being sort of recognized and appreciated more widely. So I'm grateful for that. And thank you for your time, and I'm happy to take questions.
Hey, Pooja, first of all, go MD class of 99. Amazing talk. I'd actually like to ask, if I could, about a topic that I think is very related. And it struck me when I saw the map that you had of New York City, because I work at a hospital that is right on the park, but has a catchment area that was one of the most orange, and has some of the highest levels of childhood obesity in the city, has some of the highest levels of pre-diabetes and this one. So that, it's like the up and to the right of the Central Park Triangle. That's our catchment area. But among those things that we can also ascribe to exposure to outdoor places, it has one of the highest levels in all 5 boroughs of food insecurity. And when you are food insecure, that doesn't lead to the best food. Sometimes you just can't get the healthiest food. And there is also a lot of data that suggests that access to these outdoor spaces, and you brought up like farming and growing, all of that. Have you, in your work, been able to look, or have people in this field been able to look at some of these green spaces and getting access to better and healthier food choices and combating food insecurity?
Yeah. I mean, I think the gardening and farming interventions, they often come up in parallel. I mean, there needs to be more of that, I would say, but the ones that I'm most familiar with are often in preschools and schools, and kind of community gardens that are, so as people are transforming these schoolyards with community input, sometimes there is this like, well, we don't even have a place to grow food, and so there are some schoolyards that have set up elaborate community gardens, and then there's a different sense of kind of ownership of people coming in there, taking care of the garden, but while you're there, that means there's adults there that care about the space, so they're also taking care of the larger space. So I don't know how much it's necessarily changing the landscape on food insecurity, but I think it's, and there is also programs and research that support, for children, for example, when they're involved in gardening or planting, they're more likely to try different fruits and vegetables, and they're more likely to eat them. So there's those additional benefits of like, if I know where this tomato's coming from. I know my children ate salad the first time that we grew it in our backyard when they were little. So I think that I think there's a lot of power there, both to inspire healthier eating, and maybe at a larger scale to impact food insecurity too.
Hi, Pooja. Thank you. It was great. I love the fact that in that initial questionnaire, you asked people about did they have access to a park 10 minutes away that they felt safe in, right? Because it's one of the things, even this morning when Jeff and I were walking, we're staying down near the Omni, and the park right there, as we're walking, I said, oh, that's a cool play structure. And Jeff's comment was, but there's so many people impacted by homelessness who stay at that park who feel safe with their kids there, right? And so it's an interesting kind of thing that I hear a lot of talk about sometimes about how do we help people impacted by homelessness, but not so much about how does that affect, what's another benefit in terms of providing access for young people to a park that feels safe. And so I wonder if there's a tie-in in terms of in-community advocacy for looking at both of those things together, that it's not just whether people feel comfortable, but it's causing then a decrease in the access for kids who need it. And so it's where my thought is going.
So many layers there, and maybe Deb and I need to get together and solve this problem of how does everyone get, sort of, how are public spaces, the role of public spaces for everyone, and yes, and how everyone can have access to it. I mean, one thing that when you were speaking, a story that came to mind, this is from the Seattle area or just south of Seattle. There was a park in a community that, most of the residents were immigrants or refugees from all different parts of the world, and many of them didn't speak the same language. And I think the story goes like there was, there was like a young person and somebody who used to like coach soccer, and they decided that they would put up some flyers in a bunch of different languages and said like Sunday at 2:00, like come play soccer or something along those lines. And initially like 3 or 4 people came, but over time it became like a full-fledged program where people who often did not speak the same language were now showing up and playing soccer, and it was getting competitive, and they were figuring out how to get uniforms, but not just the the sort of 12 to 20-year-olds that were typically playing soccer, but then their families, their moms and their younger siblings, and then there was like this like play structure is dangerous and we need to get this fixed. And so there was this idea of like activating that space that became safe and comfortable for the broader community to be in. It's not completely addressing how do we handle the situation when different people need access to that space. That might be the only space for some people to be, but I think that like they're, as a community, kind of thinking about how do we make this space accessible and safe, and how do those sort of spiral into or grow into programs that do make it a welcoming space for more.
Pooja, unbelievable talk. I really enjoyed that, and I'm going to just echo what Dr. Gilheenan just said. Go MD class of '99. You and Deb really make us so proud. I'm really proud to be your classmate. And so, well, first of all, I got to get on the phone and call my son, who's probably in front of a computer right now, back in LA, and tell him to get outside. And I think you should have given this talk outside too. So I want to run outside there right now. But you mentioned 20 to 30 minutes of recess a day. And our prehistoric ancestors, basically lived outside,
Yes,
right? They had
yeah.
shelter, but the rest of the time they spent outside. They feel like maybe that's kind of very, very healthy, right? Just kind of like what you're alluding to. But is there an optimal time for kids to spend outside during the day? Elementary school, maybe more than, I don't know. Is it 20, 30 minutes? Is it an hour? Is it 2?
Are you asking for the dose
Like,
of
what do you
outdoor
think?
time?
Yeah.
Yeah.
If I had to actually write a prescription,
Exactly.
like, what do you think? What's your
Yeah.
personal opinion as
I mean, I
to
think
what's
that-
the optimal? Yeah.
For sure. I mean, that's a question that like lots of people are thinking about, like literally like what is the dose of outdoor time? And, as people are making more sort of scholarship out of this, like, is there an ideal amount? And so I don't have like a great answer for you in terms of, recommendations. Like, so the physical activity is pretty clear, like 60 minutes of moderate to vigorous physical activity per day for kids is what we recommend. We want as much of that to be outdoors. So if I had to like, write a prescription, write a dose down, I would say an hour. Like we should get at least an hour of outdoor time, especially because as humans and historically we've spent way more than that, and our indoors are way too comfortable and inviting and addicting now. So I would say at least an hour a day if people needed to make a program or policy recommendation around that, more if possible.
Great, thanks.